Welcome to the Keto Geek Podcast. Let's do this.
Health. Nutrition.
Dude, is this the thing we ordered from eBay?
It is. It's just way bigger than I expected.
Well, it was sold by this guy whose profile picture was a purple nutsack, and he said that this gauntlet was created by Peter Dinklage in the heart of a dying star. Do you know who Peter Dinklage is?
Oh, the guy from Harry Potter.
No. It's the guy who plays Boromir in Lord of the Rings and just dies in every goddamn movie.
Oh, yeah.
Anyway, so I ordered this gauntlet for you from all the way across the country. I think it was in New York or something, or at least that's what they said. But what exactly does this thing do? Because I want to know all about it, because I paid expedited shipping and quite a bit of dough from our Keto Geek account to get this goddamn thing right here.
Well, I'm excited to tell you about this. So I did some research on this gauntlet and found out that anything that you attach to it will harness its power. And since we have so many people out there in the keto world chasing ketones, looking to raise their ketone levels, I figured the energy pods do just that. They help raise ketones. So why not? Let's stick it to this gauntlet here and harness that energy.
So theoretically speaking, you could use this gauntlet to elevate the ketones of everybody, or how high do they go?
Correct, but not everybody, just half of the universe.
Oh.
And it goes to 5,000 millimoles.
Dude, that's insane. Do you know what happens at that level?
You become a superhuman, of course.
No, you become you get ketoacidosis, you die, basically.
Well, we'll see.
Do you know there's only one person I know on the top of my head who could help us if everybody or half the people get that much amount of ketones in there? It's crazy. Do you know who that is?
No, who is it?
Well, it's Carrie Diulus. Have you heard of her?
Oh, Carrie, yes.
Well, Carrie Diulus is a kick-ass human being. She's an orthopedic surgeon. She practices patient-centered medicine rather than the traditional disease-centered model. She identifies all the factors that influence the patient's health and then combined with the state-of-the-art, minimally invasive surgical and medical care, including complementary and nutritional approaches, she develops an individualized program for each patient's unique needs. So that also explains, by the way, everybody's different, so their ketones are going to be different. And you want to take it to 5,000, really. She's also a type 1 diabetic. She's a vegan. She's everything. She's practically awesome. Do you have anything else to add?
Yeah, I actually do. Carrie is really good at covering up who she actually is.
What?
I did a little bit of digging, and this is what my research brought to me. Carrie Diulus possesses superhuman strength, endurance, stamina, flight up to 6 times the speed of sound, physical durability, a sixth sense, and is resistant to most toxins and poisons. In her binary form, she is able to absorb energy and fire photonic projectiles while being able to survive the vacuum of space. She is cool.
Are you sure we're talking about the same person?
Yeah, Carrie Diulus. She's the vegan keto doctor.
Okay. All right. Where did you find out about that?
On her LinkedIn profile.
Not on Twitter, right?
I don't go over there. There's too much of a war zone there.
She also has an Instagram account, by the way.
I don't follow her.
Oh, I do. I think everybody should follow her. She's pretty badass. Especially if that stuff is true.
It is.
All right. I'll fact check you on that. Anyway, guys and gals, we have some great news for you, and we sent out our first shipment to Amazon, so expect our products one by one to be on Amazon Prime. What that means is you will get 2-day shipping and instantly get the product onto your doorstep, which is a big milestone for us. It was a step-by-step process of just taking our product, which was literally from scratch. If some of you people who have been with us through this entire journey, you saw how we had literally had naked pods. Now they're labeled in a beautiful box, and now they're ready for distribution and going all over the world. And yes, we are still working on Canada. So we'll see how that turns out. We have a lot of interest from very different places across.
It's pretty heavy.
What are you doing?
I'm just going to try it on.
Dude, half the population don't know.
Look at this thing. This is cool. Oh.
Uh-oh.
Holy moly.
It has an on button.
Apparently it does, and man, I think I'm harnessing the energy pods right now.
How do you feel?
I feel pretty good. It says the bearer of this gauntlet, for whatever reason, if you snap your fingers, it will release the energy that it harnesses.
Don't do it. Everybody, no, we can't have people's ketos.
You know what?
To 5,000.
You know what? What could go wrong? Let's do this for science.
Everything can go wrong.
No. Jenkins!
Dude, doesn't look like anything's wrong. Everything looks fine. I hope that was just a fluke.
I feel like a little fuzziness. It feels like I'm getting a lot of energy. I think my millimoles are rising. My ketone millimoles.
Do you think you could lift 100,000 pounds now?
I probably could. Oh, I don't feel so good now.
Dude, your legs are going.
Dude, what's happening? I don't want to go like this. No.
I don't know what to say over here. It's weird. I did not expect that. Wow. We're in the end game now.
Being within the lab in the hospital and being sort of the doctor's doctor was what I thought I wanted to do. And then when I injured myself, I couldn't see myself sitting and looking at a microscope for 20 hours a day because I'm far too active of a person. And when my sports career kind of shifted. So I thought I was going to go into sports orthopedics, given my background. And then I sort of realized that sports orthopods spend most of their time watching other people do sports and not getting to work out as much as they would want to. And I actually am not a huge fan of watching sports. I want to be doing them. So, and then my second year of residency, I got to work really closely in third year. And then beyond that with some really amazing spine surgeons. And I really loved the surgery. And the patients were the anatomy, and the patients were people that I was able to really connect with and sort of, understand where they were at. And spine is one of those funny things. In orthopedics, people either love spine or they hate it. And, there's a lot of chronic pain that goes on with it and with the different pathways. And that's a lot of how I got into doing some of these, quote unquote, alternative things or different pathways. Is because I would see people that a surgery wasn't going to fix them, but I'm really bad at getting out of the room if I don't have a plan. Just saying, I'm sorry, there's nothing I can do. So it became, I'm sorry, I don't have, a surgery in my toolbox, but let's kind of figure out if there are some other tools that we can consider here. And so, for the past 10 years or so, I've been looking at how do we utilize other things, sleep and connection and exercise and, smoking cessation and all of those things, some of which are more standard and others are, like I said, it's relatively new that we're looking at how do we get somebody into ketosis and utilize beta hydroxybutyrate as an anti-inflammatory. So it's really gratifying to be able, I've sort of fallen into this path and it fits me really well, but it's really gratifying to be able to take somebody who's had pain for a really long time. And maybe I do surgery, maybe I don't. But at the end of the day, with all of this stuff, to be able to have them say, wow, I'm really glad that, I met you and I got to come see you and that we went down this path because I feel great. So.
Okay. And what kind of steps do you take that reduce the invasiveness of a surgery? As in, let's say if I come up to you, what would you say compared to, let's say, somebody else?
I mean, there are a lot of people that are doing a lot of innovative things within, the spine community. Like I said, do everything from we're able to avoid surgery in some patients just by shifting their diet. So, they see every new patient sees me and physical therapy at the same time. And I have an amazing team of physical therapists that are here with me. So that's helpful. And we don't talk about weight in my clinic. We talk about inflammation. And I always sort of joke that I'm trained as a construction worker, but I really work more like a farmer, in that sometimes the farmer needs to build a barn, which would be surgery, but a lot of times it's soil quality and rain and, rotating crops and all of that other stuff. So when I'm working with somebody, the question becomes, how do we reduce inflammation? And so that's a whole conversation that probably doesn't happen very often in other spine surgeons' offices. And then I do other things, epidural steroid injections and things like that I do on my own. Part of it's because I'm compulsive and I want to see if I'm going to do a surgery on somebody. If I put the medicine right here, what's the smallest footprint that I can do that will get them the most active? And then there are minimally invasive surgeries that are newer surgeries where we can do, relatively big decompressions and fusions through tubes. And so small incisions, very low blood loss, faster return to, activity, that, are some of the things that are not done at all practices. Plus, all of my patients who are surgical, I put them on a ketogenic diet. And we don't have, we haven't quantified the data yet. But, anecdotally, I can say that I'm seeing people use less pain medication. We're getting them out of the hospital faster. And people are, getting back to the level that we were hoping to get them to much more quickly with fewer problems with wounds. Again, this isn't entirely scientific, but I always talk with my patients when we're talking about why to do a ketogenic diet leading up to and after a surgery is bacteria need sugar to grow. And so, one of the strategies is if you limit excess, we know that it's clear that diabetics who have A1Cs that are elevated are at a much higher risk for post-surgical infection. So my goal is to diminish as much of the excess sugar that's available in the body as possible and to have the person be in a metabolically healthy state so that their immune system functions better and that bacteria are less likely to be able to grow. Because, post-op spine infections are something that we want to avoid at all costs.
You just talked about inflammation some time ago. And so is there something called good and bad inflammation? And if there is there a way to distinguish and how do you do it?
I mean, inflammation is part of the way our body heals. So, there's this whole big push, like if you get an injury, to reduce inflammation as much as possible. And so it's like everything else with your car, you need the brakes and you need the gas. And there's just the right amount in order to heal. So inflammation is how our body heals. If you have no inflammation and you have a tear of a tendon or a ligament or something like that, then you're not going, if there's no blood flow to the area or whatever, you're not going to get healing. So, there's some speculation that perhaps we've been doing a disservice to the healing process by taking things like anti-inflammatory medications right after an injury, that perhaps we should be allowing some degree of that inflammation to be there. But then you don't want the inflammation to be too much, and you certainly don't want chronic inflammation. Chronic inflammation, is problematic. And so, one of the ways, so beta hydroxybutyrate is one of the ketones, although it's not technically a ketone, but that we don't need to get in that level of science. But so it inhibits the NLRP3 inflammasome, which is one of the ways we get inflammation. And so when I put patients on, so it inhibits NLRP3, which then downstream inhibits IL-1B. And it's also a COX-2 inhibitor. So when you think about Aleve, ibuprofen, those are non-selective COX inhibitors. And then things like Celebrex and meloxicam, those are COX-2 specific. So that's a way that the body turns on inflammation. So if you're inhibiting it, it decreases inflammation. So we can utilize beta hydroxybutyrate in that way therapeutically, although we don't know for sure yet it's still out on how high does your beta hydroxybutyrate need to be in order to have that effect. And I have some thoughts on it, but not hard and fast data. And so we want to have some inflammation, but we don't want it to be chronic and go on. We want the healing to happen. And so, the thing that I hear patients report is we change their diet. Sometimes it's just getting rid of the sugars and grains. I mean, honestly, or for some people, it's an elimination type diet. Like dairy is really inflammatory for a lot of people. But sometimes just decreasing changing their diet, and they'll come back in and they're like, yeah, my back is better, but so is my neck, so are my shoulders, so are my arms, so are my knees. And I didn't specifically do anything to treat those. We just changed the diet. So a lot of arthritis is related to inflammation.
One of the studies I read recently was about wound healing and ketogenic diet. It seems to improve. What's going on over there, if there's any sense to it?
Yeah, I mean, again, you want to have an appropriate amount of inflammation to allow it to heal, but you also want to have the substrate in order to be able to heal it. So the body heals things by laying down collagen, and then that collagen so fibroblasts create collagen, and then that's the way you heal. And if there's too much inflammation, or there's a lot of different things that lead to wound healing problems. If somebody's skin integrity is not good, if they're, like I said, metabolically sick. We know that diabetics with elevated blood sugars, it's not a good milieu for healing an incision. So, part of it is too, I think the thing that's a little harder to tease out from that is if you put somebody on a ketogenic diet, there's more thought going into their diet than the standard American diet. So is it the ketogenic diet in and of itself that is the main factor, or is it the fact that they were eating crap and now they're focusing on what they're eating? And is that what's helping them heal? I can't tease that out at that point, but the end result is people are healing better and faster, and we're getting more data that this is happening. The science is just not yet fully there to say this is the molecular mechanism behind the why.
Exactly. And whenever I personally see, I'm not a super duper expert like yourself, but whenever I see a study that says ketogenic diet does X, Y, Z, I'm curious about what's going on. What kind of ketogenic diet is it? What kind of, exactly. So this leads into the next question. How do you deduce what kind of ketogenic approach you should approach for whatever case it is?
Yeah. So for my patients, it's pretty straightforward as far as the ketogenic diet. So, and I'm sure we're going to get into the way I eat, which is a little bit different than what I use with most of my patients. But sort of my standard dietary practice is somewhat based on, what is across the board and, things that Berta is doing. But I tell patients, in this particular case, so it depends on whether I'm using a low carb diet or whether I actually want to get them into nutritional ketosis. And so there are some patients who have some neurologic conditions that I truly do want to get their beta hydroxybutyrate above 1.5. And in that particular case, we're focusing more on fats and moderating protein. And the consistent thing with both of them is lower carbohydrate. If we're talking about reversing metabolic syndrome, you can actually reverse metabolic syndrome biochemically at either ends of the spectrum. So either the very, very low fat, sort of higher complex carb, plant-based diets, you can shift the metabolism so that the body becomes more insulin sensitive. Typically there's calorie restriction involved with that. Or at the other end of the spectrum where you're in a ketogenic state, so where the cell receptors have changed so that the cells are preferentially burning fatty acids, ketones for their fuel source and sort of glucose sparing. So it depends on, for the individual patient, what our goals are. And when somebody comes to me and they say, what should my, low carb diet look like? The first question I ask are, what are your goals? So for patients where we're talking about pure surgical healing, it probably is fine for them to be low carb, and then there's a little more flexibility with the protein levels. If I have either higher on that side or lower on, depending on where they want to be and what works for them. Because at the end of the day, the diet that really matters is what someone will follow. So if I spend, half an hour going over a diet with somebody and they go home and they throw it in the trash because they're like, I just can't do this, then it's a waste of time. So I would sort of figure out where somebody's at and how we can, we do change people's diet, but It's how do we work with, what are the foods that they like? What are their food preferences? I'm not a fan of meat. And that's a lot of why I do what I do, but there's some medical reasons and some science behind what I do personally, but I just don't like it. So most of my patients eat meat, and we work with that. Most of them, when I put them on the low carb diet, it ends up being far more plants than they've ever actually eaten in recent history, because most are sort of coming from the standard American diet. So I tell them, 2 cups of non-starchy vegetables with lunch, and then 2 cups with dinner at minimum. And when you eat a non-starchy vegetable, put a fat with it, one of the healthy fats. If you eat a fat, I tell them put a non-starchy vegetable with it. And, that seems to have helped. And then the protein amount, we sort of start with a palm-sized amount of protein. And then when patients that I want to get their beta-hydroxybutyrate up sort of above that 1.5 millimole level, then we'll have them actually start to check ketones. But for the most part, the goal is just to sort of get people into the, low carb state and get a lot of the processed sort of crap out of their diet.
One of the biggest pitfalls is adherence to a diet. Are there any steps that you take that are necessary? And is that one of the biggest reasons why people fall off the bandwagon? Is that one of the bigger issues that you have to deal with? What's up with all of that stuff?
Yeah, I sort of push back against this one a lot, because from the standpoint of, as a type 1 diabetic, people say that, a low carb diet's not sustainable. And quite frankly, I'm like, that's BS, because this is how I live every day of my life. And it's makes a big, huge difference. So, we are motivated to do things where we see benefit. And so the question becomes, how do we, get people benefit rapidly, and how do we keep people healthy? Because if you don't feel good, I can tell you I was sort of low-fat, plant-based for a long period of time, and I did it because I thought it was dogmatically the right way to do it, yet I was gaining weight and my hair was falling out, and it just wasn't good for me. And you could push back and say there are ways that I could have done it better, but it wasn't good for me. So, with people, yes, motivation is a huge factor. Most people leave my office somewhat skeptical. And we sort of have it down to a science now, where we give them a packet of information. No Better Foods has given us a bunch of their cookies. So we give them we're like, here's some recipes and here's a cookie. Those things help in getting people buy-in. At the end of the day, it's got to be easy. So, I try and show people on my Instagram page as often as I can, like, I'm super crazy busy. Here's some of the ways that I do it, because it's got to be accessible. It's got to taste good. And so those are the things that are important. If people don't like it, if it's a drudgery, if it's like, how often, like, as soon as I hear, when am I allowed to cheat? Then I know it's going to be a harder road with that person, because I'm like, well, let's just get you feeling good first, and then we can figure out. And once people feel better, and once you get them where they want to be, then there's more metabolic flexibility. But again, it's different. Are we trying to reverse somebody's, and I don't actually like the word reverse. I think remission is a better term for type 2 diabetes. So if we get them off of medicine, so I have a guy who came into me with leg pain, and his primary care doctor assumed that it was from, a spine-related condition. And I looked at his MRI, and I'm like, this just isn't fitting. Your A1C is elevated. Let's work on, I think it's glycation, which is, so whenever there's excess cells of sugar in the body, it gets stuck to things. So the way I describe it to patients is, think of it like a toddler with a sucker, like sticky gets everywhere. And so, we know, and that's how we can measure these advanced glycation end products, because sugars get stuck to the red blood cells, to the hemoglobin molecule. And we can measure a hemoglobin A1C. Well, they also get stuck to tendons and ligaments and nerves and, joint surfaces. So iliotibial band syndrome, like frozen shoulder, are the result of excess sugars glycating the tendons in those areas. So he ended up having iliotibial band syndrome as a result of the excess glycation. And he was probably 150 pounds overweight, on insulin, large doses of insulin for type 2 diabetes. And fast forward 6 months, he is completely off all of his insulin. He's actually off 10 of his medications, like his hypertension medication, and he was on several of those. And his pain is completely gone, and he's lost over 100 pounds at this point. And all we did, I gave him PT, and we changed his diet. There's nothing magic about it. We just limited carbohydrate. Now, if he would go back and eat a standard American diet, that, you can reverse muscle insulin resistance. It's harder to reverse liver insulin resistance with some of the science there. So, are we truly reversing type 2 diabetes, or we're managing it? I think that's, it's in remission is the term that I like to use, because if you go back to eating Captain Crunch or, other high carbohydrate processed foods, then your blood sugars are going to elevate significantly.
That is interesting. So what exactly is the definition of insulin resistance in your eyes then?
So it's a metabolic process. So it's where the body, you can't fill a bucket up with more than it can hold. And so when available fuels are in excess, then the body starts to say, whoa, I can't handle it. The cells say I'm full and I can't handle anymore. So the receptors actually change, and we know, so we describe insulin as the key, and the glucose transporters, GLUT4 being one of them, where these things change, and then the body can't utilize the sugars. The body can utilize it, but you end up with excess sugars in the blood with nowhere effectively for them to go, which is where they create the problems, because the cells are like, I'm full. I can't have any more. So when the cells start to say that, that's when we start to see an elevation in blood sugars. And so what happens then, the pancreas starts to produce a lot more insulin to sort of override it, because the body doesn't want to have excess sugars or excess fatty acids floating around in the blood unless they're utilizing them. And that's why all these engineers are doing a great job, like system analysts, looking at this system from their perspective, because it's no different than what they're doing in their daily lives. So it's fascinating to hear Dave Feldman and Ivor Cummins go over all of this stuff and give their perspective on it. And it's incredibly valid. And, we should all be paying attention and learning. So now the pancreas is making a ton of insulin in somebody who's got metabolic syndrome. And that's why if we truly want to understand if somebody has a metabolic syndrome, we not only measure a fasting blood sugar, but we also measure their fasting insulin level. Because you can paradoxically, if you take somebody who's got constant high insulin levels all the time, because they're feeding all the time and their body's doing that. Now you fast them overnight before you get their fasting blood sugar. Their blood sugar in the morning may actually be paradoxically low, because the insulin's finally able to work because they're in a fasted state. So you'll go to your doc and the insulin level, their fasting blood sugar will be within normal limits, and they're like, you're good. You don't have metabolic syndrome. Whereas the reality is, if you would measure their A1C, if you would measure their fasting, blood sugar in addition to their fasting insulin level, you would see their fasting insulin level is elevated. And that tells you you've got metabolic syndrome. Or conversely, you give them a glucose challenge and measure what happens with their blood sugar over the next hour or 2 hours, and then also measure insulin levels. And you can see these massive spikes in insulin in people who are, progressing towards type 2 diabetes and have a metabolic syndrome. And then once the body can't keep up enough, that's when we say that they're diabetic. So when the pancreas is no longer able to sort of keep up and the blood sugars keep going up and up and up, and eventually the pancreas can kind of burn out, and a type 2 diabetic can become more like a type 1 diabetic, although type 1 is an autoimmune condition, but it's where the pancreas doesn't produce enough insulin. And so that's, when we talk about putting type 2 patients on insulin, that's where that thought is coming from. Although, now it's becoming more controversial about, is giving insulin to type 2s necessarily the best thing to do? I think dietary changes are a much more important thing to do first, and I have concerns. I mean, when I was diagnosed as a type 1 diabetic, I was already a practicing surgeon at the time. And the first thing that happened as soon as I went on insulin is I gained 10 pounds. I mean, so if you want to gain weight, have your insulin levels be high. It's, you know.
And we had Dr. Ian Lake on our podcast. He was the first exposure to type 1 diabetes. And so what's your narrative? Let's triangulate back to you. What happened and what did you notice? Like one day normal, second day something weird going on? What happened?
No, I mean, again, so dietary stuff has always been sort of in my wheelhouse because I was 100 pounds heavier in college and I lost it. So I always sort of tried to be on top of what the dietary science was. And of course, boy, has that changed in my mind and in my own practice and in the science and what's being talked about clearly, which is why we're here at this point talking about it. But so I was out sort of talking about in a public way, how do we utilize dietary strategies in orthopedic patients so that we can better improve their metabolic health so that they can have better clinical outcomes. And I went for an executive physical and in my late 30s. And she called me back in. She's like, your A1C is elevated. I'm like, what? That doesn't even make sense. And she's like, well, you know, it's probably type 2, moving in the wrong direction and things, you know. So ultimately, you know, at that point I was like, this doesn't make any sense. I have no family history of, you know, type 2 diabetes in my immediate family. Obesity for sure, but not type 2 diabetes, despite the obesity. And so I, at that point, cleaned up. There were some, you know, ways that I could clean up my diet. And I was sort of pescatarian paleo at that point, I called it. And I was trying to sort of get my blood sugars to be under better control. And it was gradually getting worse and worse and worse to the point where I was effectively zero carb for a number of months, mostly meat and fat. And again, I'm not a huge fan of it, of meat, but that was what I needed to do. And then I got sick and the wheels came off and we got a C-peptide level, which is a measure of how much your body's producing insulin. And at that point, it was clear that I was a type 1 diabetic. So I was put on insulin. And for a couple of weeks, followed the standard American diabetes recommendations of you have to eat this much carbohydrate in order to give yourself insulin so that you can provide the insulin that your body needs. And like I said, within 2 weeks, I gained like 10 pounds. And my blood sugars would fluctuate from 40 to 400 in that period of time. And I'm like, this is, you know, I have a lot of education in science and I can't figure out how to get this to match up. So I'm like, if the problem is carbohydrate, I'm just going to go back to limiting carbohydrate and giving very, very small doses of insulin. And so that's what I was doing, you know, for a while. And then I ended up finding, and that made it dramatically better. I mean, significantly better. And, you know, then I found Dr. Bernstein's book, and that was sort of validating to find that and say, okay, here is a type 1 diabetic who's an endocrinologist, and this is what he's doing. And then there's the type 1 Facebook group called Type 1 Grit. And fast forward, you know, we did a study showing that was just recently published with David Ludwig, among others out of Harvard, looking at how beneficial a low carbohydrate diet can be in a group of type 1 diabetics who are following this. So, you know, and my diet was pretty omnivore, ketogenic, and I played with varying levels of protein, so high protein, moderate protein. For me, I find that the protein part, I have to keep it lower. As, you know, a middle-aged woman, the more protein I eat, the more insulin I had to give, and I was sort of struggling with weight on a higher protein side of it, which I know different people have different experiences with that as far as the protein amount. But for me, the scale didn't lie. And the other side of it was there's, you know, high sensitivity CRP, which is a marker of inflammation. I couldn't get mine below 1.3 no matter what I did. And ideally it's below 1. And I would have patients that would go from 20 to like 0.7. And then while I was happy for them, I was like, oh, I'm mad at you. Like, why can't I get mine down there? So then, lost my ear thing. So I ended up, you know, because the universe, I guess, likes to have fun with me sometimes. And I got this really bad virus and ended up in the ICU with DKA, which is diabetic ketoacidosis, not nutritional ketosis. And after that, I got this post-viral gastroparesis, which means my stomach stopped working as a result of the virus impacting the nerve. And it just can it can happen to anybody. It's got nothing to do with diabetes. It just was an awesome, ironic coincidence. But the problem was, as a type 1 diabetic, like, it's super tricky to get foods in, and the diet for gastroparesis is like saltines and Coke. I mean, they actually like, and I'm like, well, I have celiacs and I'm diabetic. That's not an option. So I had to figure out, I was losing weight rapidly. I had to, which is, never a problem I had in the past. So I had to figure out how it was to feed myself so that I didn't end up with a feeding tube. And protein was the hardest thing. I sort of found other ways of doing it with fats. So I sort of reverse engineered gastric emptying. So how fast things move through your stomach and how do I speed that up? So MCT oil, compared to other oils, goes through your stomach relatively quickly. So I was utilizing MCT oil. I was utilizing some branched chain amino acids, and I was able to tolerate those. But any sort of whole protein, so I'm allergic to eggs and dairy. So I couldn't use whey and I couldn't use egg protein. I was doing smoothies, and it ended up being, I found a lab and I was able to get just pure amino acids. So they tasted terrible, but I was able to sort of put them around stuff and do that so that I could correct. We actually measured my amino acid levels, and my branch chains were okay because I was able to do that, but the rest of it looked abysmal. So I was doing that, and then I found that I was able to transition to plant-based proteins like pea protein, hemp protein, things like that, much easier than, again, because I couldn't do whey and I couldn't do egg protein. And so I started adding those proteins in, and it was great. I was able to transition. My stomach started working again. I was able to add in more foods and eat more things. But meat was still I just had no taste for it. I didn't want it. My stomach didn't want to handle it. It was too much for it. So at one point I was like, why am I even fighting this? I had been plant-based for a long, long time. It was just this belief in my head that in order to be low carb, you have to be, eat meat. And I was like, you know what? I'm going to just play with this for a while. I'm going to just go totally, which I was already anyway. I mean, it wasn't like I already was. Like, that was what I was doing, and it was working. So I'm like, I'm just going to embrace this for a while and see what happens. Well, what happened was my, insulin levels went down even further than they had been. And my control was improved. I no longer was getting sick all the time. My high sensitivity CRP went to like 0.2, 0.3, and it's just stayed there. My sleep is great. My hormone levels, I'm, in my mid 40s, so effectively perimenopausal, but my hormone levels look great. So that kind of went away. So at this point, I've been sort of, it was a while that I got into it. And then, about a year ago, I'd been doing it for a while, and I said, out loud sort of for the first time that, listen, I'm doing this and fully embracing it, just sort of hold this space. Like, I think we need to have omega-3. So I take algae oil. I'd be fine with fish oil, but I kind of want to prove that you're able to do it and be entirely plant-based. But the second I get feedback from my body, my labs, my energy levels, whatever, that it makes sense to add some animal protein back in or animal oils back in, then I'll do that. But at this point, there hasn't been a reason for it. So it's not a dogmatic thing for me. It's just, I've been doing this. Now, it always comes up, do you supplement B12? Yes. You can't be plant-based and not supplement B12. But I supplement a lot of things with my patients who are, omnivore keto anyway, like vitamin D3, fish oil, and people who don't, eat a lot of omega-3s. So, is this the diet for everybody? No. Is it, do I think that there are a lot of people who benefit from, I try and post the foods that I eat, the plants, to give my patients ideas what to do to include more, non-starchy vegetables. To get the polyphenol, there's a lot of phytonutrients and polyphenols and things like that are in plants that can be of benefit. So sulforaphane, that's, found in the cruciferous vegetables being one of them. There's some metabolic pathways that can be, and gene pathways even that can be impacted by sulforaphane. So, there's some benefit there to doing all of that. So that's sort of how I ended up in this plant-based low carb world. And it's funny because the vegan community is like, oh, you're keto. You have keto friends. You like hang out with those people. You can't be vegan. And I'm like, well, that's great, but I don't eat any animal products. And by the way, I spent most of my life not doing that. So I'm not sure what your definition of it is, like whatever. But I mean, again, for me, it's not a dogma thing. It's not a religion thing. It's just, hey, I got super healthier doing this. So I'm going to keep doing it. I mean, I'm making gains in the gym still all the time. So, and then the keto people, again, a lot of this, which is why we're here, they're like, no, you can't be plant-based. I mean, I remember the day when Dr. Noakes was like, no, you can't. It was on Twitter. He's like, you can't do plant-based and be keto. And I'm like, well, I've been doing it for a while now. Like the plate looks very similar. I mean, it's like non-starchy vegetables and fat. And then it's just the proteins that I use are different. So I avoided soy for a while. I'm totally fine with non-GMO soy at this point. I haven't seen any negative, impact from it with me. If that changes, and I'm, sort of biohacker, so I pay attention to a lot of stuff. If it changes, I'll consider getting rid of it. But I do black soybeans and tofu, edamame, lupini beans, which are an Italian bean that by the time they're sort of, the soaking process and the brining that goes into them, they have zero net carbs. And like I always say, carbs can't hide from a type 1 diabetic. So, I eat those, and hemp seeds and sacha inchi seeds. And there's these things called baru nuts. And, there's some really good proteins available in mushrooms. So, mycoprotein, which sounds kind of weird, but you can actually make some amazing things. So those are the proteins, that I have. Some pea protein shakes. I try and be as whole foods as possible, but I do, like on my heavy lifting day, I will have a protein shake after it just because I don't necessarily want to eat something, but a protein shake does fine. And I do some branched chain amino acid supplement with that too, to sort of make sure that my leucine levels are high enough to sort of stimulate mTOR.
Wow.
So that's how I got here. Yeah.
That is pretty awesome. And here's where I personally stand when it comes to dogmatic thinking. Whenever I see someone doing something that's ridiculously strange or something that's pushing the boundaries of a certain knowledge base and they're very strong about it, my first impulse now is to ask them why, what's going on, what's driving you, what you're doing. And I think that's the kind of mentality that people need to have. And I used to be in Pakistan at one point, so I saw the conflict, in the 9/11 conflict from both sides. And it's interesting how humans can develop these bonds against each other, not bonds, but just shatter the bonds against each other. But I think there's a different level of courage that is required to go and ask the person, okay, how does this work? How can other people who have similar conditions that can benefit from this? Which is the same reason, if people are curious, is why I approach people like Sean Baker in the first place. How can you survive doing just that? And how can you fight doomsday with kryptonite armor?
We're both orthopedic. Yeah, Sean and I were both orthopedic surgeons. We have very different approaches to it. And, yet we both, are thriving. And so, again, the human species is incredibly adaptable.
Oh, yeah.
Right? Like if you look, because however long ago, I mean, at least, before we had air travel and all of that, you ate the food that existed where you lived. And so, that's why we are able to exist. And, metabolically, you can utilize foods in different macro ratios to turn pathways on and turn pathways off. And there was a really cool study that just came out, maybe it was 2 weekends ago. It was the whole thing about protein. It's a big issue. But there was a study that showed that people have a high cellulose diet. So it actually wasn't inulin, it was cellulose. That is, one of the plant-based fibers. That the gut microbiome of those individuals is different. So, there's a group of people out there who are fruitarians. And so they don't eat, most of them are raw and they just eat fruit. And the funny thing is, you don't actually see amino acid deficiencies in them, and the question of protein deficiencies as long as they're getting inadequate calories in. But yet I see obese people who are older who have protein deficiencies. So, it's not a simple 1 + 1 = 2 when it comes to getting in the nutrients that you need. And so what the study showed that was cool was that people who have a high cellulose diet have gut microbiome with bacteria that are able to help pull more of the plant proteins out of the protein. So when we talk about bioavailability of plant proteins, it's possible that again, why can we live on this planet in many different environments? Because our bodies and our microbiome are able to adapt so that we can adjust. We just don't adjust to eating all of the processed crap very well.
Yeah, it's beautiful. It's a symphony where people can substitute here and there and still make it work. It's really fascinating. And so these people that just eat fruits, have you done some reading on that and why this is working? Because to be honest, that's a paradox.
Yeah, I mean, there are people who do that. I have a friend, who has been sort of fully raw. I mean, she does vegetables too, but for 13 years now, and she looks great and she's doing great. I mean, at the end of the day, you can't, throw fault to somebody if, they're doing really well. We do have the metabolic flexibility. The thing that I'll say is we see people do a lot of crazy diets, and you can lose weight. Again, it depends on what your goal is. If your goal is like to thrive in longevity, I think that's a different answer than it is if your goal is to lose 15 pounds. So you can lose 15 pounds eating just Twinkies or McDonald's if you calorie restrict, right? So it's what's your goal? If your goal, like my goal is to keep my blood sugar as normalized as possible, to utilize the lowest doses of insulin I can to be physiologic, and to have my inflammation be as low as it can so that I can live as long and active a lifespan and a health span as I possibly can. So, and I do think that we have more ability, so people go on a low fat, plant-based diet, and you can make yourself much more insulin sensitive with that. Particularly in a calorie-restricted diet. So there was just a big conference in Zurich on nutrition, and Sarah Halberg talked about, there are 3 ways that you can shift people's metabolism. You can calorie restrict, you can do bariatric surgery, or you can do a low-carb diet. And so if you're only providing your body with carbohydrate, small amounts of protein, very, very small amounts of fat, like less than 10% fat, the body will utilize available fuels, which in that case is glucose, and it'll get really good and efficient at that. The problem I see with it is, and you can do well on that for a while. So how young you are, how much reserve you have makes a difference with, how long you can do that. The thing that I have seen happen with some people is that omega-3 deficiencies start to become an issue. We have essential fatty acids that we need in our diet, omega-3 being one of them, and we have essential amino acids that you have to get in. We have no need for carbohydrate. And so you can improve, if you go from eating crap to eating a very low fat plant-based diet, you may, and there's tons of people in the vegan community that are like, hey, I am so much healthier than I was. My weight is so much better. And for a long time, I experienced that until I didn't. And then it became a problem. And I kept trying to do it, and calorie restricting and exercising more. And it might, like I said, it just wasn't great for me. So how do the people who just eat, raw fruits and vegetables and do well with it? It's not a diet that I do. I try and include a lot of raw fruits and vegetables. I think there are, things like broccoli that actually were better off heating, the lycopene in tomatoes that is activated by heat. But, getting a wide variety of plants in your diet if you're not sensitive to the lectins, and that's a whole other, sort of rabbit hole to go down into, but can be beneficial for a lot of people. So again, if you lived in an equatorial sort of area of the world, you may be eating a diet that's high in, tropical fruits and, tubers and, nuts and seeds and, things like that as part of your diet as, over the evolution of the human species. They looked at the teeth and the sort of plaque to determine what is the diet that our ancestors ate. And it was varied. It depended on where you lived. So the whole concept of, we were ketogenic throughout history depends on where you lived.
Mm-hmm. I call nuts the OG of shelf-stable foods. That's how I describe them.
Yeah.
So it's really fast.
I have to be careful with nuts. Like,
oh yeah.
Yeah, like I can't go crazy. Like peanut butter is like crack for me.
Oh yeah.
So
yeah, and
I
we're
have to be super careful.
Yeah, and we're finding out as a food company that depending on how you process those foods, because that's technically our homework, to figure out, hey, what can we do to create foods that are anti-obesogenic, and how can we work with the texture and different kind of things. So that's a whole new rabbit hole as well. We could talk for days, by the way, now. But let's go back to this one big misconception.
How do you keep the fatty acids? Yeah, like how do you keep the fatty acids in the food that you're selling stable so that they're not oxidized by the time we eat them? Because all of the problems, that's I think part of the reason why, and we'll go to your question, like part of the reason why so many of the low fat plant-based folks do really well is because they're getting all of the processed seed oils out of their diets. And, those oxidized oils are really problematic. So just that alone may be part of the health benefit that they're seeing, is because now you've gotten rid of this entire class, by definition of being super low fat, of oils that are problematic.
Definitely. So. It's really fascinating. We're just exploring all of this, and it's a huge rabbit hole. But let's open up this can of worms, which is which is one of the fears that a lot of people have towards vegetables and fruits and all that kind of stuff. Is they think, some of the claims are that there's toxins in there. Are they something to be worried about?
Yep. Yeah, I mean, here's the thing. So in my clinical practice, I do see people who we remove foods that have certain lectins in. So the lectins can be beneficial or not beneficial, right? So plants have these phytonutrients in them, and some of them are a defense mechanism, and some of them have benefits in the human body. So sulforaphane is in broccoli. It's got significant, benefits that we've been able to biochemically and, understand within the human body. Are there people who have sensitivities to some of the different lectins? I anecdotally can say I've seen patients who get rid of these things from their diet and they do much better. And I think we have to pay attention to those things. Now, some of them may be that a certain group of people have developed leaky gut, which is where some of these molecules absorb through before they're properly digested, and that they're more likely to be sensitive to these things. And if they fix their leaky gut, then they're able to then go back and tolerate some of the things that were problematic before. There are others, like I said, I have a ton of sort of food sensitivities that I have to be careful with, and I'm sort of the canary in the coal mine when it comes to that. Yes, there are certain things. I can tell you flax seeds break me. Like, I can eat fiber all day long, every day from green leafy things, and my gut is completely fine. If I have even the smallest amount of flax seeds, like, you don't want to be anywhere within a confined space with me, because it's just not, like, my gut is not happy at all with them. So is it the type of fiber that's in them? Could I slowly, increase it and, be okay with flax seeds? I don't see a reason that I need to keep flax seeds in my diet. And, so I'll utilize them in small amounts. Usually when my husband's away for the week, so that he's not angry with me. But, so we have sensitivities to foods. There are people who are sensitive to dairy. There's people who are sensitive, there's this, particular type of carbohydrate that's in beef that, you may have seen the studies where there's this tick bite is leading to people who have an IgE related allergy to this carbohydrate that's in, beef. Alpha-gal is, it's a galactose molecule. And so, you know, there may be some other sensitivities to those that are, you know, our body's reaction. And perhaps some of it has to do with all of these environmental things that we're exposed to, that were things our, you know, great grandparents weren't exposed to, you know, BPA and, you know, I mean, just all of the industrial stuff that we're around, that maybe those are factors. But, you know, there's different things like wheatgrass. A lot of people are really a huge fan of wheatgrass. I cannot, I'm nauseated for an hour and a half, 2 hours if I have wheatgrass juice. And God bless the people who like it, but I have tried, I have failed, and then I was stubborn and I tried again more than a few times because it's supposed to be super good for you. Yeah. Not happening. I don't ever have wheatgrass now because I just identify that it immediately makes me sick. Some of these things make people sick further out, so, you know, hours out or longer, and so it's harder to directly correlate that. But yeah, there are some foods that, you know, we shouldn't necessarily be, not everybody, but that you as an individual may find you do better with. I mean, I can tell you I went on a low carb, vegan, low lectin diet at one point. Like I had like 3 things that I could eat, but I didn't notice any difference in anything. So there's some studies that show that, you know, the antibodies that are involved in type 1 diabetes may be elevated as a result of some of the lectins in certain plant foods. Well, if that's the case for me at all, I didn't see a difference, and my beta cells are already gone. So, you know, and I use super tiny doses of insulin, so it's not like I'm trying to, you know, minimize that further. So I didn't see a difference, and I add lectins back, and I'm okay.
Yeah, I can say the same thing about oxalates.
Dr. Gundry may Yeah, exactly. Oxalates. I mean, yeah, there are people who are have significant problems with oxalates. And, you know, I can have kale in a smoothie every day. And I mean, I had a green smoothie every day for like a year and with citrus in it and never once had an issue. So.
Yeah, same here. We love our nuts over here. So I just, something happened here. Oh, we're still going. But yeah, so
got it.
We keep nuts over here. I mean, we make foods from using nuts. So we consume them on a regular basis. Sometimes I will consume maybe 8 ounces to maybe a pound in certain cases when I have literally nothing to eat. And it doesn't seem to cause that much issues, or if any issues at all, that I could potentially notice. But then again, I have a very athletic sort of background. I've always worked out or been in sports, which brings me to this one interesting question, which is you work out, you stay in tip-top condition. And so being Superman and fighting Doomsday with kryptonite armor, how's that been for you?
Yeah, so at this point, I mean, I've done it the wrong way a lot of my life. And I've spent more time injured in my life than I would like to have been. So I'm really working on how do we utilize those cues to exercise smart and not hard, to get the maximum benefit and minimize injury. So there's again, I tie everything back to clinically. So clinically, we see sarcopenia of aging, which is as we get older, we lose muscle. And that's what leads to, you know, hip fractures and falls and spine fractures that happen that are osteoporotic. So my goal is, how do I minimize sarcopenia of aging? So the workouts that I do, I lift about, like, weight wise, I lift once a week, and it's sort of the, you know, McDuff, body by science. I go to failure. It's what I do now is a little bit different, but it's sort of loosely based on that. And I go to failure. And again, the thought of all of that is, how do you activate type 2 fibers? You know, again, interacting on Twitter with Ted Neiman, you know, I've got a pull-up bar in my bathroom, and it's not TRX, but the Jungle Gym or whatever in there. And so that it's not, during my week, it's actually not formal. Like if I walk past my pull-up bar, I'll be like, oh, I'm doing pull-ups now. And, you know, or I'll do rows with the, you know, the body weight stuff. So, you know, I'll do those things. I did pick up doing handstand push-ups from TED just because it's fun to, like, I did them in front of my mom one time and she's like, would someone tell that woman how old she is? And I'm like, but I can totally do this. It's fun. So, that it's a lot of that. So the lifting part of it is, once a week, really, really super hard. And you know it and you feel it, for the next day or so that you've gotten there. And then I do, again, okay. So there's a study that just came out in Cell that showed that endurance sports and weightlifting and then sprinting, so high intensity interval training from cardio, all have metabolic benefits. So I try and include all of them. I come at this from an endurance running background and endurance cycling background, and I had sort of let that go for a while. I'm getting back into it right now. Whether that proves to be good for my body or not, I don't know. It's too early to tell, but I enjoy it. Like, I love distance running. I don't love the weight room, although I've learned to love the weight room and I learned to love like the music that I listen to, and it's a whole thing. But I also once a week do high intensity interval cardio to failure where I like do 90 seconds all out and then fall on the floor, trying to get air in and then repeat it. And then that's sort of done for the week. And I try and make sure that I'm super active, all day. Again, there's a lot of stuff behind the, 10,000 steps. But for me, that is more a sort of reminder of keep moving. So go outside in the evening after dinner, try and go for a walk. Although lately I've converted it to, I'll go for a jog on some days. But like this week, on Monday after my workout, I woke up and I'm playing with some heart rate variability stuff. And man, my heart rate variability tanked. And I was like, all right, I'm going to listen to this. I didn't feel great. I'm like, I'm going to not, in the past I would have been like, it's on my schedule to do this workout today. And I would have done it. Now I'm like, I'm just going to exist today and, make sure I move a lot, but not formally work out. And then sure enough, Tuesday, I started to feel like my heart rate variability went down even more and my insulin requirements went up. And I just had that little bit of a feeling like I think I'm fighting a virus. I didn't feel sick, never got sick. It's a day later, I feel great. Heart rate variability is back up. But, my insulin requirement was up and my heart rate variability was down and I was like not working out today. I had a busy day in the operating room, so that was enough activity for me. And now today I slept great last night. I feel great. I'm going to probably, go do something this evening to be outside. And so that's what it looks like. And it will change, what I'm doing a year from now may look different, but that's what I'm doing right now. I've been sort of playing with running. And so as a low carb type 1 diabetic, what I find is my blood sugar will actually spike with cardio, with weightlifting, with high intensity interval training. If my heart rate gets above 155, my blood sugar goes up. Glycogen is released and my body's sort of preferentially using fat. So I've been playing, again, Tucker Goodrich, who's on Twitter, another Twitter thing, where he was like, oh, you could go back to running. You could totally go back to running. And I'm like, no, I'm good. I'm old now. I'm good. I don't need to run anymore. And then I was like, all right, I wonder if I can run, and keep it sub-threshold and see what happens. So I've been playing with what is the highest I can get my heart rate and not have a blood sugar spike at all. And so then the experiment I ran last week was I had actually done a modified fast for 5 days, which was sort of a fat fast. So, my beta hydroxybutyrate Saturday morning was about, 4 millimolar. And then I went for a run and it went up to about 4.4 millimolar after that. My blood sugar stayed totally stable. I do take glucose along with me because as a type 1 diabetic, that's just stupid not to, we have insulin that we give ourselves. But my pump was able to be effectively off during that time. I was running on entirely fat. So who knows? Maybe a year from now, I'll be like, oh, I'm running a lot. Maybe I'll not be running at all. Who knows?
No, that's fantastic. I think you're in the boat with Dr. Ian Lay because he's doing the same thing. He's trying to run and figure out. So maybe it might be a better to tweet at him than Tucker Goodrich. No offense, Tucker.
No, it's fun, Yeah, I mean, Twitter's fun and it opens up, it's fun. I sort of use the different Instagram, I post foods that I eat so that, I have sort of people there who kind of follow in to give people ideas. And Facebook tends to be my professional page on Facebook tends to be more like spine related. I do some nutritional stuff on there as well. And then Twitter is just about having fun little quips back and forth with people in the world of diet and nutrition and all that stuff. So
here's the interesting question then. Two questions actually. How does the vegan keto compare to the regular keto? Are there any practical advantages that people can utilize over here that, we've talked a lot about it, but let's just kind of summarize everything. And then with the vegan keto, if I were to kind of, are there any weaknesses to that? Are there some things that could be improved about it?
Yeah, for sure. Why should somebody consider doing vegan keto as opposed to omnivore keto? I think it's if you're hitting your health benefits and your labs all look good, then why change anything? But if, you're struggling with some things, you're struggling with weight, you're struggling with some other health issues, then I think sort of dialing it in, and you don't have to go all the way vegan keto, but you may want to think about incorporating a day of it, or, and again, the whole ethical discussion around it, that's a whole other separate, thing that's complex. It's not a simple discussion. So, I think we need to revamp our entire food system, plant-based, animal-based, all of that. But so just take that piece out of it. So, if like I said, my energy levels were good, but they were never great. I felt like I was getting sick all the time. And, it was actually suggested to me by a good friend. He's like, well, you're type 1 diabetic and you have celiacs and all this stuff. Maybe your immune system just isn't great. And, I can tell you that the number of times I've been sick since I've done this, they're few and far between. So if you're not feeling, that's always my thing for people is if you feel, check in with yourself. And that's the first thing I ask patients when they walk in the room. I'm like, how do you feel? And if their answers, I feel great, then we leave things alone. But if something's off, I want people to give space to that. And we sort of try and problem solve through that. Like, why don't you feel great? What's going on? And then see what you can change. You can have inflammation, have a low, high sensitivity CRP, but if a high sensitivity CRP is a relatively inexpensive, easy lab to check. And so my goal for a lot of people is, dietarily, how do we optimize that? And I learned at one point, I was like, well, maybe there's just, from my own experience, I was like, I guess I just can't get below that. Like maybe it's my stress and I have a super stressful job and, maybe I'm working out too much. Maybe that's the factor that keeps it high. But man, it just made a huge shift by shifting my diet. Okay. So if something's not clicking with what you're doing in a low carb diet, then I would say, or on a vegan diet. So if you're on a vegan diet, then maybe doing low carb vegan is, a really good answer. I think, again, from the fat standpoint, I think fats can be super beneficial for people done in the right way. Okay. And then as far as how do you, avoid getting into trouble. So if you're avoiding things like soy, you need to make sure lysine is one of the essential amino acids, and it's lower in the nuts and seeds. So pea protein is a good source of lysine, or lupini beans is another source of lysine if you're not having soy. And there's actually a whole Facebook group, so it's Vegan Keto Made Simple, and last I checked, there were over 38,000 members in it. So this isn't like, me in my kitchen, the only one doing it. There's a whole group, and there's a lot of people who've shown, different ways of doing it. So I think that's important. Anybody who's eating a fully plant-based diet needs to get B12. And I think everybody needs to get, minimize oxidized omega-6s, minimize overall omega-6s. Seed oils need to be gone from everybody. You can do vegan keto and have a bunch of crappy seed oils and feel bad. So that's one of the ways that you can do omnivore keto and have a bunch of crappy seed oils.
Yeah.
And so make sure you're getting enough omega-3s. And the way to do that if you're vegan keto is through, algal oil, which is the oil from the algae. And that has both, EPA and DHA in it. It's the the getting it from other plants, the ALA, there are certain genetic factors that limit, and as we get older, the ability to convert ALA to, the DHA and EPA gets a little bit trickier. So algal oil is the thing that I recommend. So those are the big ones. I mean, and then again, if you're not healthy, if there's problems, like, don't ask the question why and work to figure out why.
Sounds great. Are people is type 1 diabetes on the rise? Are you noticing certain trends in the health industry that need to be really pointed out from your perspective?
Yeah, I mean, the biggest trends that I'm seeing that are problematic across all of it are the processed foods. So, there's a ton of these vegan fake meats now and things like that. But there's also a ton of things in the keto world where, it'll say the net carbs are 2, and now, I don't eat the bars anymore or anything like that. And sorry, your stuff has ghee in it, so I haven't had your stuff, but, which ghee is fine. Again, for most people, ghee is just fine. My kids, we use ghee with them. It's totally fine. I can't do dairy. But, so, the processed foods are problematic for me. Like, I think we're going to get ourselves into, Oreo cookies and Coke are vegan. Right?
Oh, yeah.
And some of the Beyond Burger is, a meat substitute that's pea protein. I don't have any issue with that. The thing that I have issue with it is it's got canola oil in it. Now, I don't let that stuff anywhere near. Like, I'm one of those that I bring my own bottle of olive oil with me to the restaurant because I don't want the seed oils anywhere in my diet at all. So, when we're looking at these processed things, it's like some companies, they get close and I'm like, I would totally consider eating that, but it's got this in it and that's crap. I'm not going to eat that. It's just not worth it for me. And a lot of the bars, the keto bars or whatever, the issue is the carbs. What they're using is fiber to subtract to give you the net carbs. In me, I'm like spiking to 180 and now I'm giving myself insulin. I'm like, oh, they lied. They totally lied. I'm not eating that bar ever again. So, for me, it's trying to stay as much whole food as you can because there's, an avocado is an avocado is an avocado, right? And although our refrigerator it got really hot here in our refrigerator that we keep produce in at my house froze. And now I have a whole bunch. I usually buy avocados when they're really green and then I leave them in the fridge and then I pull them out as I'm ready to use them when they have them on sale. Because here sometimes we can get them for like 50 cents or $1 a piece. And they all, like I have like 15 or 20 fully ripe avocados ready to go. And I'm like, I better do something and freeze those or they're going to go to waste. So that's the biggest thing is the processed food industry. Like to make it easy and make it convenient, that's great. But, it becomes a problem. So when I see people on a standard keto diet and they're like, I'm not losing the weight, I'm not getting where I want to go. I'm like, well, what are you eating? They're like, well, I'm having an Atkins bar for breakfast and, then something with a bunch of mayonnaise on it for lunch and, dinner bacon, which is whatever, that's fine and all that. But then they're putting ranch dressing with, again, crappy seed oils into it. So they're low carb. They're high fat or moderate protein, or high protein, whatever, but they're, still having things that are potentially problematic in there. And like I said, dairy is a problem. I see dairy being a problem for a lot of people. Not necessarily ghee. In fact, a lot of people who have problems with dairy can actually have ghee. Because the milk proteins are removed. But if somebody's really stuck and they've done all the other right things, then we'll take dairy out to see if we can, shift things that way.
Sounds good. But yeah, we have some gripes with our fellow food companies at the same time. And it's It's interesting. And sometimes when we do certain events and Corey and I are just chilling there, we're like, we want to go inside the room and talk to the educators. We don't want to hang around here in this crew. So it's kind of weird. Right. But because we love it, you guys are so smart. And every time we sit down with one of these educators, yourself included, we learn so many new things. And it becomes a good and a really interesting challenge to take what you have and just constantly evolve our messaging and try to somehow incorporate that into our product. It's a wonderful and a beautiful challenge for us. So yes, we really appreciate that. And what's funny is when we started our keto journey, we had a few people that wanted to create certain keto vegan products as well. So maybe down the road, we might look into that and keep you in the loop as well. So I think we've killed a huge amount of time here. And I swear, like I said, we can talk for hours. And you probably have.
I was going to say, if you create a keto vegan one, because I travel a ton, I am always looking for stuff that I can throw in my bag. So send me an email. I will be your first customer.
Oh, if we do it, we are as arrogant can be. We will be hands down the best because we don't compromise on anything. So yes, we will keep you in the loop. So is there anything else that you'd like to discuss here? Because we could talk forever.
No, this has been great. I'm really super grateful for the opportunity to get to sort of go over, this strange path that I'm on, but talk about some of the myths and some of the places that we all, commonly get stuck.
Sounds fantastic. Are you going to be at Low Carb or any of those events?
I'm actually thinking about going to Low Carb Houston.
San Diego. Come to San Diego.
I'll be in LA for a spine conference. I know, it's funny. Like my day job is still being a spine surgeon and I do all of these things. Be like, you could write a book and all that. I'm like, I still actually am a spine surgeon. That's how I, make my living. This stuff is super fun, and it's super important, which is why I do it, but I still am a spine surgeon. So my dance card, the good thing, it's a good problem to have because, the spine and orthopedic community has gotten much more interested in how do we utilize dietary strategies with our patients. So that's a good thing to do. But I think I'm going to try and make Low Carb Houston work out. I haven't fully, my secretary is going to kill me when she's not aware yet.
All right. Sounds fantastic. Thank you so much for being on the show. We should definitely do a second part for this later down the road and cover literally about 75% of the questions that I have on my computer that have not been covered. So you are a great narrator, fantastic educator, and we will do anything to help spread your word out. And let's give people more tools to figure out solutions for their problems. Thank you so much.
No, thank you. Thank you for the opportunity. I really appreciate it.
Thank you for listening to the show. You can visit us at ketogeek.com to check out our premium keto-friendly and low-carb food products, including our infamous energy pods, made from the best ingredients we could find in the entire country. We also recommend signing up for our newsletter at ketogeek.com/signup, where you get exclusive discounts, rewards, product announcements, and the latest content we are working on. You also get a 10% discount on your entire order when you sign up. Go to ketogeek.com/signup to join the low carb playground.